Hi, I'm Dr. Akshay Dhandha, consultant orthopedic and joint replacement surgeon. And if you're a man in your 30s or 40s whose knee has been giving out and you are not sure whether to actually push through or do something about it, today I'm answering every question that men have about knee pain and knee replacement. Let's go. Arjun Kapoor from Delhi asks on Reddit, Doctor, I'm 37. I work out 3 days a week. My x-ray says severe arthritis. Does that mean I need a knee replacement surgery now? Not automatically. Indian men often get trapped in a bad loop. Gym, pain, denial, painkillers, more load. And the load continues. An X-ray word like severe shows cartilage loss, but surgery timing is decided by real-life function. Think of arthritis like a worn bearing in an engine. It's not just roughness. It starts changing the way forces move through the joint. But you still don't replace the engine the day you hear a noise, right? You replace it when the problem starts blocking your life, even after proper repairs. Total knee replacement is usually considered when pain is daily, including night pain and rest pain, when walking and stairs become a serious limitation. When you have tried a real conservative plan, strength, weight, activity modification, medication strategies, and injections, when deformity or instability is progressing. And here is the male nuance. Many men power through pain and keep ego lifting leg press and squats. That can actually accelerate symptoms because weak hips and quads combined with bad form increases knee joint load. Your knee is replaced for life-limiting pain and disability, not for severe on X-ray. Rohit Nair from Bangalore posted this on Reddit, and this is a term that confuses a lot of people. What is end-stage arthritis actually? Is it literally bone rubbing on bone? Sometimes, but not always. End stage means that the knee has lost its smooth cartilage layer and the joint becomes both mechanically and biologically unstable. Here is the deeper picture. Cartilage loss reduces cushioning. The bone underneath develops stress changes. It gets more painful. The joint lining, the synovium, gets irritated and inflamed. The knee starts changing alignment, bow leg or knock knee, concentrating load on one side. In Indian men, end stage can happen earlier. Old sports injuries such as ACL, meniscus, that were ignored. Heavy occupational load from standing long hours, warehouse work, police or defense drills, delivery jobs, and higher rates of central obesity and metabolic issues even in men who look fit. Arthritis pain is not only bone rubbing on bone. It's load, it's inflammation, alignment, and muscle weakness all acting together. Vikram Shetty from Mumbai dropped this one on Reddit, and this one comes up a lot, especially with active men. I'm 42 and I play weekend cricket and football. Why are younger men getting knee replacement surgeries? Isn't this a 60+ surgery? See, most men under 50 who reach severe damage usually have a story. Usually injury plus time. The common male pathways: post-traumatic arthritis from an old ACL tear, meniscus tear, cartilage injury or a fracture. The joint wears faster over 5 to 15 years. Misalignment, where bow legs overload the inner knee like a misaligned bike tire. Metabolic load, belly fat and insulin resistance creates chronic inflammation that makes joints more sensitive and slow recovery. And inflammatory arthritis, which is less common but important, immune-driven swelling that damages joints earlier. Key nuance: if you're under 50, you should be asking, is total knee replacement the best first solution? Or is there a joint preserving option? In selected men, things like realignment osteotomy, targeted rehab, bracing, weight reduction, or even injections may delay the requirement for a total knee replacement. Early severe knees in men are often injury-driven. The best solution depends on what your root cause is. Suresh Iyer from Chennai asks this on Reddit, and this mix-up is extremely common. I have uric acid problems and gout. My knee swells on and off. How do I know if it is arthritis, gout, or a ligament injury? Many Indian men get mislabeled. Every knee pain becomes arthritis. Every swelling becomes uric acid. Quick science. Gout is crystal inflammation. Attacks are sudden, hot, swollen, very painful, and may jump between joints. Osteoarthritis is mechanical degeneration. Pain grows with activity. Stiffness after rest, slowly progressive. Meniscus or ligament injury causes pain with twisting, locking, catching, and instability. A good doctor differentiates with history pattern, examination such as effusion, joint line tenderness, stability tests, weight-bearing x-rays for osteoarthritis, ultrasound or aspiration in swelling cases to check for crystals or infection, and even gets an MRI done if required. Do not let your knee get treated blindly. The diagnosis changes the treatment completely. Nikhil Mehta from Pune commented on YouTube, and steroid injections are probably the most misunderstood in this space. Can steroid injections avoid knee replacement surgery? For many Indian men, injections become a quick fix because taking time for rehab feels impossible. But injections are not magic cartilage rebuilders. Steroid injection reduces inflammation. It's best used as a short window to enable exercise and physio. Gel or hyaluronic acid improves lubrication in some cases, but the results are mixed. Platelet rich plasma or PRP is promising for some early to moderate cases, but the outcomes vary because of inconsistent preparation. The deeper truth: arthritis is both structure, alignment, and collapse, and biology, inflammation. If your knee is structurally collapsed with deformity, injections may reduce pain temporarily, but will not restore mechanics. And the male nuance: many men take injections and immediately return to heavy squats, long rides, turf sports. That wastes the injection benefit and the knee flares again. Injections can buy time, but make sure you do a proper rehab. Without rehab, injections become an expensive postponement. Deepak Pillai from Kochi sent this as a DM on Instagram, and this question comes every time a robotic surgery is mentioned. What is robotic knee replacement? Should I pay extra? Does it mean my knee will last longer? Robotics can improve precision, more consistent bone cuts and alignment, fewer alignment issues. That's the genuine advantage. But long-term comfort isn't only precision. It depends on ligament balance, infection prevention, and pain control. This enables early movement, rehab quality, and your weight, strength, activity patterns, and expectations. Men often approach this like buying a better car variant. Top model equals best outcome. Surgery is not like that. The engine includes your muscles, your metabolism, and your rehab adherence. So, smart question to ask your surgeon: how many total knee replacements do you do per month? What is the rehab plan and who monitors it? How do you reduce infection risk in diabetes or smokers? And what exactly is the extra cost that I'm paying for? Robotics can improve precision. It does not override lifestyle, rehab, and risk factors. Rahul Sharma from Delhi commented on YouTube, and this fear stops a lot of men even considering a surgery. What do you actually replace in total knee replacement? Is it like removing my knee? I'm worried I will not be able to go to the gym again. It's not removing your whole knee. It's resurfacing the worn joint surfaces. Simple anatomy. The femur, your thigh bone, gets a metal cap at its end surface. The tibia, your shin bone, gets a metal base. Between them sits a strong medical plastic liner, and that is the new gliding surface. Sometimes the kneecap is resurfaced too. Why you can return to the gym. The joint becomes stable and smooth, and then your muscles take over the job of control and shock absorption again. But post total knee replacement, gym is not going back to ego lifting. It is training smart. Think cycling, controlled strength workout, form correction, progressive loading, not maximal squats and jumping. Total knee replacement is a precision resurfacing procedure. Your gym future depends on how you train, not just what implant you have. Akash Verma from Hyderabad asks on Reddit, and this is probably the most practical question that men ask me. I am a working guy and I cannot take long leave. What is the realistic timeline? Walking, driving, office return? This is the core male concern. I'm the earning member, I cannot disappear. Typical timeline, and this varies by health and rehab. Day 0 to 1, standing and walking with support in many cases. Week 2, walking short distances at home, basic independence, improving naturally. Week 4 to 6, many can return to desk work if the commute is manageable and the pain and swelling are controlled. Driving depends on which side and how well the control of the knee is. Most need several weeks and surgeon clearance. The deeper science. Recovery is not only wound healing, it is neuromuscular relearning. Your brain has to trust the knee again. Muscles have to regain power, swelling has to settle. Two things delay men specifically. Impatience. Overdoing it leads to swelling and pain, which leads to setback. And the I am fine attitude. Skipping physio leads to stiffness. If you want an early return to work, invest in pain control, daily physio, and a proper home set. Karthik Menon from Chennai left this on YouTube. Important one, guys. How painful is the first 2 weeks of surgery? And what should genuinely scare me? What are the danger signs? Pain is expected early, but it should be managed enough that you can walk and do exercises daily. Swelling can last weeks. What is normal? Swelling, warmth, bruising, sleep disturbance, and gradual improvement. Danger signs. Do not ignore these. Fever with chills, wound leakage or rapidly spreading redness, calf pain or swelling, sudden breathlessness or chest pain. The deeper science. Surgery triggers inflammation and a temporary tendency for clotting. Your wound is a vulnerable entry point for infection. So prevention and red flag awareness are the most important part of the procedure itself and the male nuance. Men often delay reporting symptoms because it does not feel right to complain. That is exactly how small problems become big ones. Early reporting of red flags protects your results. This one came in from multiple men, Reddit, YouTube, Instagram, all asking the same thing. After total knee replacement, can I squat, sit cross-legged, use Indian toilets, play cricket and ride my bike daily? This is the Indian plus men question. Let me go through each one of these questions individually. Squatting and cross-leg sitting, not guaranteed. Some men get partial ability, but deep flexion can be limited depending on flexibility, weight and knee mechanics. Indian toilet. Long-term deep squatting is not ideal for many. A Western commode or raised seat is safer, especially initially. Cricket. Later, controlled activity is often possible. Casual batting and fielding may be okay. Sprinting, sudden turns, sliding, higher risk. Bike riding. Possible, but long rides can increase early swelling. Gradual return with swelling and strength control is key. Gym, yes, but joint smart. Cycling, controlled leg strength, hip strengthening. No ego loads. Avoid repetitive impact and jumping. Here is the deeper framing. Total knee replacement is designed to restore walking, stairs, daily independence travel, and work life. But if you can also do high flexion, treat it as a bonus, not a promise. Men often judge success by, can I do what I did at 25? A better success metric is, can I live pain-free and stay active for the next 15 years safely? Aim for a functional, durable knee. Adapt your lifestyle intelligently. So if you are a man in your 20s to 40s, your knee problem is often injury, alignment and load. Do not chase shortcuts. Build strength, fix mechanics, manage weight, control diabetes, stop tobacco. And if you need surgery, those same steps decide how good your outcome will be. If you're unsure whether your knee pain needs evaluation, a second opinion, or a surgery conversation, you can consult a verified orthopedic surgeon on Practo for personalized guidance. They will help you understand where you actually stand. If this helped you, share it with a guy who you know has been limping through his workouts and telling everyone he's absolutely fine. And if you want to keep up on actionable advice and stuff that actually matters, subscribe and hit the bell icon today. Thank you.